All right. Thank you everyone for joining today. Really appreciate you taking time out of your busy day to be here. Just want to check really quick, is everyone able to hear me? Okay, perfect. Thank you. So just some quick housekeeping before we get started. We do have Spanish language interpretation available from my colleague Federico, who's on the line. Federico is providing that service. You can use the service by clicking the little globe icon at the bottom of your screen and then selecting to turn that on. So just so that you know that that is available. And like I said, I am recording today's session so that we can post that and the content is available for any partners who are not able to attend today's session. So thank you again for joining. I know this is a busy time of year, but we are very happy to have you here for the October 2025 edition of the Marketplace Monthly Updates. Hopefully, you know who I am, but if you don't, my name is Amy Coven, and I'm the Communications and Public Engagement Analyst with the Oregon Health Insurance Marketplace. And I am happy to be here. I'm always happy to see familiar faces and definitely happy to meet new ones as well. So thank you again. So just to get going here, for anyone who I don't know, maybe you've been on vacation or something and forgot, open enrollment does begin in just a couple of days on Saturday, November 1st. So as I said, I know we're in the we're in the middle of a busy time, excuse me. And just for everybody to make sure that we're all on the same page, open enrollment is ending January 15th of 2026 this year. Um, we want to make sure that you remember that there's a couple of different enrollment windows within open enrollment. So if you enroll between November 1st and December 15th, then your coverage is going to start on January 1st. And if you enroll between December 15th and January 15th, your coverage will start on February 1st. So definitely want to make sure that you keep those dates in mind. If you are helping clients with enrolling through the marketplace, it would be a good idea to make sure to try to get them in, before that December 15th date to make sure that there's not going to be any gap in coverage or anything. And for folks who are currently enrolled through the marketplace, they will be auto enrolled into the same or a similar plan for the next year. So they won't have a gap in coverage and they'll be able to go in and make any changes if they would like to up until the end of open enrollment. So we just wanted to give you some reminders here ahead of open enrollment to make sure that we're all on the same page. I know that there's, excuse me, there's a lot of things happening right now. There's a lot of talk nationwide about changes, and we just wanted to make sure to set the record straight and make sure that you all have the same consistent information. So, starting out with who is eligible to shop through the marketplace. So this year, you do have to be legally present in the United States. That does exclude DACA recipients. That is a change this year. Remember, DACA recipients are unfortunately no longer eligible to shop through the marketplace. In order to use the marketplace here in Oregon, you do have to live in Oregon. You have to not be incarcerated. And to the marketplace, that means that you have to not be serving time in jail or prison. It does not include people who are on probation, parole, house arrest, or are pending disposition of charges. So I always like to say if you're spending the night in jail because you got picked up on a drunken disorderly charge, you can still keep your marketplace plan. But if you get convicted of that charge and you're actually sentenced to time in jail or prison, then you're no longer eligible. And then you must not be eligible for Medicare Part A, for free Medicare Part A. If you have to pay a premium for Medicare Part A, then you can shop through the marketplace. This is actually pretty rare that people have to pay a premium for Medicare Part A. Typically, it's going to be folks who have immigrated to the US and haven't built up or accrued enough work credits. If you have any questions on that, I recommend reaching out to the Social Security Administration with your client. They'll be able to help them see if there is a premium, or they can log in on Medicare.gov. But for most people, it is going to be free for them. Medicare Part A will be free, premium free. But for some folks, there is a premium. And then for who may qualify for financial assistance through the marketplace, and this is a little bit of a change for this year. So, and I do want to caveat all of this with this is where we're at right now. Things may change. I think that, if you're paying attention to the news at all, I know I am as much as I need to. um, things are very much up in the air on if any legislation will go into effect or be passed. So just keep in mind that we will update you if anything changes, but we want to give you the most current information as where we are right now. So as of right now, heading into open enrollment, to qualify for financial assistance through the marketplace, you must not be eligible for public benefit programs. That includes things like Oregon Health Plan, OHP Bridge, Medicare with premium free Medicare Part A, and most VA programs. You must have a household modified adjusted gross income of less than 400% of the federal poverty level. We have updated our FPL charts to include that 400% income limit. So you can find those on our resources page. And Miranda, I'm wondering, I see you that you're in the meeting here. Would you be able to drop the short link to that resources page in the chat for me? That would be super helpful. And then you must not be offered affordable coverage from your employer. In 2026, the affordable coverage is the least expensive plan available to you that costs 9.96% of your annual income or less. So just a reminder for the affordable, excuse me, I'm having a hard time with words today. For the affordable coverage from your employer, they're going to look at the plan that's available to the employee only, and they're going to look at the least expensive plan. And then they're going to compare that premium to the household income. And if it's less than 9.96% of the household income, then it's considered affordable. Now, you don't have to do all that math on your own because we do have our employer coverage affordability tool, and it's really easy to use, and you just plug in a few key pieces of information and it'll tell you if the plan is considered affordable or not. And then again, last but not least, in order to qualify for financial assistance, you do have to enroll in coverage through the marketplace. This is very, very important this year as people are considering their options with the change in financial assistance eligibility. If folks make sure that your clients remember that if they decide to enroll directly through an insurance company now, and later financial assistance becomes available, they may not qualify for that financial assistance because they're not enrolled through the marketplace. But if they enroll through the marketplace, they're likely going to get the same plan. And if financial assistance becomes available later on for them, or if it increases later on, then they'll be able to recover some of that money on their taxes at the end of the year. So we like to encourage folks to enroll through the marketplace because it is going to be your best chance at saving the most amount of money. Before I move on, just want to ask, is there any questions? Does anyone have any questions before we move on? All right. Well, not seeing any yet, so I'll go ahead and continue. And Miranda is in the chat, so if you have any questions, she will definitely see those as we are going on here too. Thank you, Miranda. So the next thing I want to talk about is the expected premium contributions for this year. Now the expected premium contributions, what those are is it's the amount that you are expected to pay towards the premium based off of your income for the year. And so this is all based off of the second lowest cost silver plan that is available to you. Remember, you might remember from your training that the expected premium contribution is the amount that is used to determine how much of premium tax credits you're eligible for. So what they'll do, what the marketplace does is they say, okay, so where do you fall in the income range? What is your, FPL percentage, your federal poverty level percentage? And based off of your federal poverty level percentage, what is the expected premium contribution percentage that you are expected to pay, right? So if you're between 100 and 133% of the FPL, your expected premium contribution for this year is 2.07% of your gross income. So they will literally take your income, they'll multiply it by that 2.07%, and that dollar amount is going to be what is considered affordable for you for your monthly or for your premium. So then they compare that amount to the second lowest cost silver plan. So if you were to line up all the silver plans from least expensive to most expensive that are available to that particular person that's enrolling, they would look at the second lowest cost one and they would say, okay, is that one less expensive or more expensive than the 2.07% of their income? And if it's more expensive, which side note, it probably is, they're going to do some math and they're going to figure out what's the difference. And whatever that difference is how much in premium tax credits that individual is going to be eligible for. Okay. So these percentages, these expected premium contribution percentages are going up this year. This is a higher amount than what we've seen in the past. And this is where we're seeing the change from the American Rescue Plan Act. When the American Rescue Plan Act passed and the enhanced premium tax credits went into effect, these percentages they actually dropped. They were lower than what you see here on the screen. And that 400% and higher did have a cap. It was 9.65%, I believe, if I remember off the top of my head. So now you'll see that they have gone back to pre-enhanced premium tax credit or pre-ARPA ranges. So they are going to be a little bit higher than they were before. And then folks that are at 400% of the FPL or higher are no longer eligible for premium tax credits. Any questions on that? I know it's a little bit confusing, so I just want to make sure everyone understands that change. It's going to be important that you understand, because if you're helping anyone through this process, through an open enrollment this year, I think it's important to be able to understand and to be able to explain to your client exactly what's going on and why the changes or what exactly the changes that's happening. So there's no silly questions. Please feel free to ask. None? All right. Everybody's an expert. All right. I'll let you guys sit on that and noodle for a little bit. We'll move on to the next topic. But if you have any questions that come into mind, feel free to drop them in the chat and Miranda and I can answer them for you. We're more than happy to. That's what this space is for. All right, well, moving on to the next topic is our annual marketplace certification training. Just a reminder that the certification training is due by the end of this month, and that is so that you're ready for open enrollment, which again begins on Saturday. Assisters, you do have the option to actually right now, this is a little bit inaccurate for right now, and I apologize, I should have updated. We currently only have on-demand training available. So if you go to the link on the screen, there will be some information on how to access that training. And there are 2 different training options available, both certification and recertification, depending on your experience. So if you haven't finished your training and you're an assister, please visit the link here. Make sure that you hop on and do that. And if you have any questions about where you are in this within the status of what your status is within the realm of training, within marketplace certification training, please feel free to reach out to Miranda. And Miranda, maybe if you want to drop your CP email in the chat, that might be helpful for our sisters on the call here. And then for our insurance agents and brokers on the call, this year, for hopefully the final year, you do have to take the CMS training. So the CMS did release their training on September 22nd. They sent their email out they sent the information out by email, and the link that's here should be accurate and working. Let me click. Donna, is that link, are you asking because the link is not working? Okay. Let me see. So I think what might be happening, that last digit is an L. It's a lowercase L. When I first typed it in, I put uppercase I and it didn't work, but I put lowercase L the second time and it did work. But I will go ahead and drop the full link in the chat here so that you have it. So if you're an agent or a broker and you haven't completed your certification, please do so as soon as possible. We want to make sure that you get that training done as soon as possible so that you don't run into any issues with our friends on the federal side. And we know that they're a little bit more strict this year on the agents than they have been in the past from what we've heard. So I just want to make sure that you guys don't run into any issues working with the healthcare.gov system. Just as an aside and a reminder that with moving to a state-based marketplace next year, we do fully intend to migrate our insurance agent and broker training to our state-based training next year. We're super excited for that because we've gotten really, really great reviews from our sister community on our state-based training. And so we're very excited to help you guys move over to hopefully what will be a good experience, a better experience, if you will, with the new training. So just a little preview of kind of what's to come. Speaking of which, we're going to move forward to some updates on our state-based marketplace project. And no problem, Donna, I'm happy to help. Actually, before I move on to the updates here, Francis, you had asked a question. So is there any dollar amount we can find out? Can you, Francis, I'm not sure I understand the question because I'm sure you're talking about this information. Let's see. If you want, you can come off of mute and ask your question because I'm not sure I understand. I'm sorry.
Yeah, the percentage that we can reference, like how much money, if let's say they earn about 80,000 or 100,000, things like that. Is there any specific dollar amount that mentioned in the
Oh, gotcha. Okay, I understand.
premium? Yep.
Yeah. So you're saying to kind of match up with these expected premium contributions. There's not a specific dollar amount, and the reason for that is that it depends on how many people are in their household as well. So it's going to vary greatly. Also, these expected premium contributions are ranges. So it's not, it can fluctuate depending, like for example, if you're at 140% of the FPL, it's going to be somewhere between 3.10 and 4.14. So we don't have a way to know exactly what the exact percentage is, but let me see if I can work with my team to get any other specific information for you, or if there's any other tools that are available. No problem. Perfect. Okay, so moving on to our state-based marketplace project updates. We have been, hopefully everyone in the meeting knows that we are in the middle of a very large project to move the Oregon Health Insurance Marketplace from a state-based marketplace that is using the federal platform, which is healthcare.gov, over to a full state-based marketplace that has its own technology and customer assistance center. Um, we have officially executed our contract as of August 4th or 6th with the solution vendor, which is Get Insured. And so our project team has been moving forward with activities to start implementation with Get Insured. There's been a lot of work behind the scenes to work on really honing in on the budget and the schedule and all of that kind of good stuff. Um, Also, another big update is that our federal friends at CMS have formally acknowledged that we do plan to transition to a state-based marketplace for next year. They have done that by posting our declaration letter and our initial state-based exchange blueprint, both of which are required to be submitted to CMS on the CMS website for state-based marketplaces. So very exciting that they have acknowledged that we are moving. It's a step in the right direction. We have a lot more steps to take, but we are excited that we have that we've made some good progress. And just to give you an idea of kind of where we're at in the progress, this is the timeline for phase two. So far we have completed a lot of project management activities. We have completed the solution vendor procurement process and onboarded our solution vendor. So now we are in the implementation phase. And there's a lot of things that go within this implementation phase. There's going to be a lot of testing and operational readiness reviews and training and just connections with the Federal Data Services Hub and all sorts of things. So we are going to be busy, but we want you to be involved every step of the way. So we are going to continue to provide updates to you all at these meetings and at our monthly collaborative meetings in each region. And then we also have our quarterly listening sessions. If you haven't been attending those, I encourage you to register and join us. These have been happening every quarter since January of last year. We had our October one yesterday for assisters. We have one today, this afternoon, for insurance agents and brokers. And our topic for this month is really an introduction to our solution vendor, which is Get Insured. And they are talking about kind of an introduction to the platform, what to expect, and just a high level of what the capabilities are, and what the timeline will be for implementation. And then the primary goal of these listening sessions really is to get feedback from all of our partners on the process and how you can be involved and where you would like to be involved. So for our sisters, apologies, our session was yesterday, but we did record that session. And I will drop the link to that recording in the chat here so that you can watch it. And then for our agents, like I said, if you have the time today, I know everybody's busy, but we would love to have you join us. And once you register for one, you will be registered for them all. So, okay, so here's the link to the assister session. So you can rewatch that. And then if you have any feedback or questions about the project, we encourage you to visit our FAQs page. We've got a lot of really great information on that page already. But if you have any additional feedback or questions, please feel free to visit the URL that you see on the screen here. You can submit that feedback or those questions, and those come straight to me. And then I'll work directly with our project team to get a response, and we'll respond directly to you. And then if applicable, we'll put them on our FAQs page. Um, so we are working very hard to make sure that our sisters and our agents and insurance carriers are as well are included in the process, and that you have all the information you need to feel comfortable and confident with this transition. We do also want to make sure that you're aware that we do have a project website where we are posting project documents, reports, just all of our old newsletters, just tons of information posted on that website. So feel free to visit that. We are sending out a quarterly newsletter. The last one went out in August, and the next one will go out here within the next week or two. So if you haven't received those, we encourage you to sign up. There's a lot of good information in those. And then we always share updates and get feedback at our Health Insurance Marketplace Advisory Committee meetings. You can learn more about the HIMAC at the link on the screen. And just a side plug, which is not in the slides, but we are currently looking for members for the HIMAC. So if you or one of your clients are interested in serving on the HIMAC, we encourage you to take a look at that website and consider submitting yourself for nomination, because we are absolutely looking for new members, especially enrollments, or especially enrollees, sorry. All right. So I just want to give a moment to ask you all, what is happening in your community? Is there anything, are there any events coming up? I'd love to see you guys drop those in the chat. If you guys have any, enrollment events that are being planned, or other outreach events that are happening that you are going to be attending here soon, please feel free to drop those in the chat. Our outreach team is always happy to hear about new events that are happening that we don't know about, especially enrollment events. We want to get those up and on calendar and help promote those for you as well. Our outreach team is always in the field. It's crazy. Their schedules are crazy. And if you haven't seen them at an event, I would be very, very surprised. If you want to see if our outreach team is going to be coming to an event near you soon, you can go to our calendar. The link is here on your screen. We do keep that up to date. And then if you have an event that you would like some support or some help with promotion, you can contact your regional outreach and education coordinator. If you don't know who that is or would like to find out, you can visit the link here, and all the contact information is on the screen. Francis, thank you for that information. We will make note and definitely pass the information along to make sure that we know that Enadina knows about that as well. And then this is our current outreach team coverage map. So just want to make sure that everyone knows who's serving where. And then just want to leave you all, this is my last informational slide here. Just want to leave you all with some different ways to reach out to us if you have any questions, comments, concerns. Please follow us on social media and consider sharing our posts if you have your own social media account, especially if it's a business or an organization account. And if you tag us in a post, or if you share a post with us by message, we're always happy to help amplify that post in our stories or on our feed as well. These are just all of the different contact mechanisms that you have to reach us. And I did want to mention that on our resources page, we do have our most recent federal poverty level charts that are ready for open enrollment. We also have our new comparing coverage tiers chart as well. So those were just posted yesterday. So those are brand new, hot off the presses for open enrollment as well. All right. Well, I am here to answer any questions that everyone has. But aside from that, we have concluded all of our presentations. So Definitely don't want to keep you guys on the line if you don't have any additional questions, but again, I'm always happy to see you and always happy to see you and visit with you, of course. And if you don't have any additional questions or comments or concerns or anything, then you're welcome to skedaddle for the rest of the day. Stay warm and happy Halloween if you celebrate. Stay safe out there. Thank you, everyone.